There's different ways of looking at it from a policy perspective. You could take a sort of economic policy perspective and a health policy perspective, and very much in the presentation that I gave today, I was focusing on the economic policy context, which is that we've had a past history of growth in health expenditure as a proportion of GDP. And we then hit a crisis, an economic crisis, which has led to big deficits and debts. And suddenly there's a focus on containing public spending, including health spending. And so finance ministries in particular are looking at ways to get more out of current spending levels to try and restrict increases in spending over time. And this is where the idea of value in healthcare comes in, and particularly value-based healthcare. It's about ways of getting the best possible quality and health benefits out of your healthcare system within the most efficient use of resources. And so we go on then to look at the role of health outcomes measurement in that. And the measurement provides a tool. So if you're going to try and improve quality, improve outcomes over time, you need a way to be able to measure and manage that, use that data to then improve what you're doing over time. So in the Value of Health initiative, we've taken a multi-stakeholder approach, partly as a response to the very strong focus on the sustainability of health systems from an economic and financial point of view, and to try and provide a multi-stakeholder response to that. And the concept of value and outcomes measurement, we have brought a group of stakeholders together who are interested in that theme and see it as a response to the current challenges that we're all grappling with in the economic and financial context. So it works at a number of levels, and we tend to differentiate between using it for in a clinical context for clinicians providing care to patients, and then how it's used at a policy level. So on the one hand, the clinicians can use the data with patients to review the outcomes that they're getting, how they can improve. We call this continuous improvement, continually analysing the data and working out how you can do things better. So that's one example. At a policy level, once you sort of aggregate that data, when you get the outcomes from the clinical level, you can gradually aggregate it up, whether to the regional level, the country level, and you can even use it for international comparisons. And it's when you start looking at variation, be it across providers or regions within a country, you can start seeing whether there's ways that you can do things better, where perhaps you aren't doing as well as you should be compared to others. Why are some people doing better, and can you learn from that? And using that analysis of variation to improve what you're doing. The Value of Health initiative has tried to provide a platform for people coming from lots of different specialities or interests, whether they're patients, clinicians, researchers, to come together and talk about the benefits that can be gained from measuring outcomes and using that data and analysing that data. And I think this initiative, the IHD work, provides a particular insight into the different possibilities that innovations in data and data use can provide. And then by working together, we can sort of work out how best to harness that and show policymakers what are the opportunities, and policymakers in that context can be enablers for enabling these innovations to thrive and to become commonly used in healthcare.